Have you ever wondered why doctors use certain blades for their incisions? Did you know that they had options when it comes to making a skin incision? Keep watching this video for answers. Welcome to Suite 250. I'm Dr. Lance Reeves, and today I'm going to talk about which blades I like to use for my minimally invasive bunion and hammer toe correction. I'm also going to discuss why I use each one of those blades. Here is an up-close look at the different surgical blades that are used. Surgical blades are labeled by number. This is a shorthand way to describe the type of blade. For example, a 10 blade and a 15 blade are much larger. These are very common for surgeons to make skin incisions. However, a lot of times it's surgeons' preference on wanting to use the 10 versus the 15 blade for their incisions. For minimally invasive bunion and hammer toe corrections, I choose to use smaller blades. I want to make a smaller surgical footprint and use the smallest incisions possible and still get maximum results. First, let's take a look at the 64 blade. This one is about 2 to 3 millimeters and has a rounded end to it right about here. It has a cutting edge down at the belly of the blade in this direction here. This blade I use mainly for my medial incision for the correction of a distal first metatarsal. When I make this incision, I'm only using the end of the blade here, so it's more of a poke than an incision. I try not to use the belly of the blade to keep the incision at only 2 to 3 millimeters when performing the surgery. This creates a nice portal to shave the painful bump and even make a bone cut to help correct the bunion deformity. Part of the reason for this blade is that the portal needs to be large enough to remove all of the bone paste when removing the painful bump of the bunion. If the incision is too small, then this would make this task more difficult. As you can see, in comparison to this blade, it is much smaller than the 10 and the 15 blade. This is a great blade and has a lot of value in minimally invasive bunion and hammer toe correction. The second blade I want to highlight is the 67 blade. This blade is about 2 to 3 millimeters and has a similar rounded end to the 64, as you can see, but it has more of a point to it, so it's not going to make as large of an incision when cutting from this part of the blade. This has different indications for my minimally invasive bunion and hammer toe correction. Again, I'm not using the belly of the blade on this side. I'm only using the distal end, which is only 2 to 3 millimeters. I like to use this blade for capsule releases and tendon lengthening, especially in patients who have a tight capsule or contracted tendon that helps correct painful hammer toes. Again, this blade allows you to do that with only a 2 to 3 millimeter incision. Again, in comparison, you can see visually how much smaller this blade is when you look at the 10 and the 15 blade. There are times with this blade that patients don't even need a suture. Just a steri-strip can be enough to close this incision without any problems. The third blade I like to use is the 62 blade. The 62 blade is about 2 millimeters and it only has a cutting edge at the distal part of the blade. This means that over here and over here, there's no cutting edge to this blade. So as you make an incision, you're only cutting with this part of the blade. This blade works great for the bottom digit for capsule releases or tendon lengthening. I especially love this blade for hammer toe correction. If someone has a contracted digit, this blade can work wonders to help make that toe look a lot more natural. This means that any incision with this blade is only going to be 2 to 3 millimeters. This blade is much smaller and will create a smaller incision than your standard 10 and 15 blade. With this blade, a lot of times a suture is not necessary. Some steri-strips will be all you need to get the incision healed. Lastly, let's just recap the size difference in my choice of surgical blades for minimally invasive bunion and hammer toe correction. Take a look at the size of the traditional 10 blade and 15 blade next to a ruler. Now you can look at the 64 blade, 67 blade, and 62 blade, which are the blades I use for my surgeries. Now imagine how nice those incisions are going to look once they're healed compared to the larger blades. If you have any questions regarding minimally invasive bunion or hammer toe correction, or if you're wondering if you would be a candidate for these surgeries, please call our office at 615-567-5622 or visit us at coolspringsfootcare.com. Thanks so much for watching this video. If you found this was helpful, please like, comment, and subscribe to our channel.